All right, you want to say hey?
Hello.
Hey.
I'm Blake.
I'm Scott Tidd.
And, we both had our surgery just over about a month ago. Scott had his the week before I did, and we became friends in the hospital. And so I live local. And I started off at 259. Today I am 236.
My highest weight ever was 324, and time of surgery I was 305, and I've lost 37 pounds in 34 days, 33 days. And it isn't all just, you know, every time I get on the scale, you know, it's down more. I haven't lost anything in the last 10 or 12 days, but I've lost 6 inches off my belly. And, you know, you get on the scale and you go, you gotta be kidding me, you know? But then I took the tape measure out and I went, eh, you're not kidding, this is working.
Yeah, it's really good to do those measurements. It really helps.
I didn't really have any problems. I mean, anesthesia looped me out for a little while, but the next day I was okay.
Yeah, he was kind of really joking in the anesthesia, and so it was kind of, we kind of kidded him a little bit about that. So
yeah, I gave the anesthesiologist a pretty good time too. We had, last thing I remember saying was,
he said, "Where are you from?" And he said, "From my mother." And
yeah. Last thing I said was, "I'm not paying you to wake me up." And then he said, "All right, good night."
Yeah, he was kind of rapid fire. Good. Any questions? Anything we should talk about? Are you unclear about anything? The instructions, or everything going okay? Or?
Everything's been going great. I haven't had any major problems. A couple of things. I can't tolerate beans in any sort.
Yeah, it's a little early. That's
and so
yeah.
I'm just gonna stay away from those for a while. But most everything, I'll take a small bite of things and try things. I had 2 bites of a hamburger the other night, and that 2 bites was it. I was done. I was full. I was stuffed. And so,
do you feel deprived?
No, not at all. Anything I want, I'll take a taste of it, and then I'm happy.
Yep.
And like I said, those 2 bites of that burger, and I probably won't want another burger for weeks.
Yep.
But the only thing I did have a problem with was taking the Actigol. I mean, physically swallowing it. And so I finally got into a routine. I found if I take that first with a huge sip of water and then follow it immediately with my Tums, it goes down. But other than that, it would keep coming.
Yeah, it's kind of like there's some big horse pills, and so sometimes we found with a spoonful of yogurt to get it started, and then the pill, and then another spoonful after that. Soup, sometimes a bowl of chicken noodle soup. You have a spoonful of the soup, and then the pill goes right after it, and then another spoonful of soup, something like that. You can work it out to get it to go down.
Right. And I was a patch girl for about up until just a couple days ago. And don't be afraid of it. Anybody, don't. It's great. It's wonderful. It'll make you feel so much better. About 2 days after surgery, I got home and I was just sitting at the computer playing a game and crying my eyes out. No, I was winning the game too. You know? There was no reason for it. So my mom came after me and smacked a patch on me. An hour later, I felt so much better, and then I could tell it was wearing off because I started wanting chocolate, only bad things. And I remember Dr. Rutledge had told us
if you get a craving after surgery, because most of our surgery takes away cravings. So if you notice you do have a craving, that can sometimes be a little kind of pointer that maybe a little estrogen patch will help you through a couple days.
And so and so I could tell that it was getting to the end of the week, and so slept. Actually, at one point I did have 2 on, and so I took those off and I put the other one on, and kept it going for about just until a couple of days ago, and I seem to be fine now. And so
good.
No major cravings and no complications. The hospital, the nurses, everybody was wonderful. In fact, 3 of my nurses had the MGB, which was great. And so, because I was afraid of what people were going to think of me in the hospital and how you're going to get treated if people were going to look at you like, ew, but they were so wonderful, especially, I think it was Pamela was my prep nurse.
Yeah, say hi to Pam.
Hi Pamela, you were wonderful.
There you go, good.
And Noreen was my first nurse.
Say hey to Noreen.
Hi Noreen, on the floor, and they were just fantastic, especially because they know what you've been through, and they're giving you tidbits of advice and everything, and they were just so wonderful and caring. It was wonderful. It was a great experience. Yeah, and I feel great too. A couple days ago, I was just boogieing out in my living room to some music, and I haven't done that in forever, and the cats and dog are looking at me like I'm nuts. And just to say too, even just 23 pounds, I used to hate going upstairs to my mom's house, and because I would just be winded by the time I got upstairs, and even just the 23 pounds difference has made a wonderful difference in just going up a flight of stairs. It's incredible. It's great. And so, and I had borderline high blood pressure, and off and on over the years I've been on lisinopril and HCT. And my last time I did my blood pressure was in the 120s over 70s range. And so
Right.
Same here. I was on lisinopril for 2 months prior to the surgery. I just went on it because my blood pressure was getting up, and it's been normal since the morning after surgery. I mean, it's amazing. It just fixed its, you know. I've been having a little bit of nausea, like it's minor, but
yeah.
it's all the time.
Yeah, and here's what you do. That is oftentimes a little hint that you've got the gastritis. So we recommend that you go to the grocery store and get the Prilosec and take 2 of them 3 times a day for 2 weeks. Because that's often just the first little signal that you've got a little gastritis there. And what you do,
they'll cure it?
Yeah, usually.
Good.
Not 100%. Sometimes we have to go up. We go to the next level. We have like DEFCON 1, or you know, like home security. You know, there's orange and platinum and magenta. And anyway, so first thing is just some Prilosec, and that usually fixes it. If that doesn't, then we'll go to what we call the Prev Pack, which is a little bit of antibiotics plus that.
Fix mine either, though.
Right.
Mine was just starting to go away.
Right.
But it's going away, so.
Yeah, other than that, there's, I think when I came to the meeting right after surgery, I had lost like 23 pounds of salt water. And then I gained about 10 of that back over the next week. But that alone fixed my back pain, my knee pain, and I was able to just, you know, after the hospital, got out of the hospital, and we went all over the place. You know, so it does things immediately to make you feel better. And since then, I'm not even looking back. I got a trainer, and I go to the gym, and I feel good, and I work.
You're going to be your trainer's best client.
Yeah.
You can say, see what I'm doing with this guy? Say, well, I want this guy for my trainer.
I'm selling him my before picture.
That's right.
Recoup some of this money.
All right. Very good. Congratulations.
Thank you.